Medical director at Neighborhood Health, a community health center just right next door in Alexandria, Arlington, and Fairfax County. And what I want to briefly talk about are the consequences people face when they don't have health insurance. The consequences faced by individuals, consequences faced by families, and the consequences to our communities. We have about 14,000 patients in our clinic, and about 60 to 70% of them are uninsured. Excuse me. And many of these, as you probably know, are the working poor. They work for small businesses. Many of them work multiple jobs in construction, driving taxis, and different fields, but they're not able to get health insurance. And we have about 14,000 patients, a large amount that are uninsured, but the numbers across the state and in the communities that we're in are much larger than that, obviously, and we don't have the capacity to provide services to all of them. So what happens for the majority of these patients is they go without basic primary care. So we're talking about cancer screenings like pap smears or mammograms. We're talking about blood pressure medicines for high blood pressure. We're talking about medicines for diabetes. And we see the consequences of that because we see it from the other end. Once they're referred to us from the hospitals or the emergency rooms after something bad has happened, after the fact. So, for example, we see a diabetic patient who's not able to get insulin. We see them after they've been in the hospital or the intensive care unit with diabetic coma. We see a patient with hypertension or high blood pressure that wasn't controlled after they've had a stroke and been referred to us. And the reason that's important and it's tied to Medicaid expansion is that the extra funding that'll come into our communities and into organizations like ours will give us the opportunity to serve many more patients. For our organization, it's estimated that if Virginia expands Medicaid, it would bring about $900,000 more into our revenue stream. That would give us the opportunity to serve many more patients. I think the estimate was around 2,000. So think of all the bad outcomes that could be prevented if that were the case. The other thing I want to talk about are the people who are our patients. We, of course, provide them, like the Greater Prince William Health Center, we provide them with basic primary care. We provide them with dental services, behavioral health. But we can't provide them with everything. And they still face a lot of hurdles because they don't have access to health insurance. They don't have health insurance. And as physicians and nurse practitioners, we see this frequently. They usually have more out-of-pocket expenses. They usually have to jump through hoops to get basic tests, fill out forms. And considering the hectic lives that many of these people face, it's difficult for them to jump through these hoops. Frankly, it's not fair that they have to do this while people with insurance can just go and get whatever services they need when that's possible. And one of the big issues that we face, and this is in an area right outside DC, is access to specialty care. What that means is for nurse practitioners and physicians, when we have a patient with chest pain, we're not able to refer them to a local cardiologist. We're not able to get them a stress test to find out why they have chest pain. And this isn't an exception that I'm talking about. This is the case day in and day out. Patients with a young woman with rheumatoid arthritis, they're not able to see a rheumatologist to get the advanced medications to help reverse the joint damage that will affect them for the rest of their lives. And that's why this is so critical. And the consequences, going back to that theme, are real. You know, you've heard of some stories. One that I saw recently, a few months ago, I've talked about, was when I was working in one of the local hospitals. I was in an emergency room and actually saw one of our clinic's patients roll in. He was brought in an ambulance. He's a gentleman with seizure disorder, epilepsy. He's been getting primary care at our center and previously at other places. Doesn't have insurance. He was initially on one medicine, primary care doctor unable to control the seizures, on a second medicine. Now he's taking 3 different medicines. He goes to his appointments. He's responsible about doing that. He takes his medicines regularly. He checks his blood levels, but still unable to control his seizures. He gets them again and again and is in the emergency room. The night that I was working, we saw him seized 4 times. 2 of them I saw myself. He was admitted to the intensive care unit. I was talking to the emergency room doctor who happens to have seen this person many times and asking him, I just don't know what else to do. He said it's clear this person, without a doubt, needs to see a neurologist, needs to see a specialist who actually has the expertise to deal with this issue and can try new approaches to bring it under control. He's referred to a neurologist every single time he leaves the hospital, but he just never goes. He can't afford the fees it would take to see someone, at least to see someone locally. So the cycle just repeats itself. And what's interesting is, like I said, he's been taking his medicines, he's been doing his part. We can actually check the blood levels off the medications, and the night he was in the emergency room, we checked them and he had been taking his medications. But because he doesn't have the expertise that's needed to manage this condition, he goes in and out of the emergency room. I'm sure you've all heard of stories like this in your advocacy work. And that's why, I just want to outline again why this is so critical. Because it goes back to a fundamental question about whether we're going to continue to allow people in our communities, people in our neighborhoods, to continue to go without basic health care, to continue to go without services they need that should be a fundamental right. So, having said that, I just want to thank all of you for your advocacy effort in the audience. I want to thank the mayor and everyone else there. It means a lot for the communities that we're in. It means a lot for our organization, and most of all, it means a lot to our patients. So thank you very much.